So I want to welcome everyone to the SRC's Lunch and Learn for this Friday with the National Kidney Foundation of Michigan, a place definitely dear and close to my heart. And I'm going to welcome Ms. Ann Andrews and Lanita Pickett, who's going to do the presentation today. But before we get started, I am Christy King, the Association Executive for the SRC. And I'll tell you a little bit about us if I can get the screen to move. Maybe not, maybe so. Let me see here. So just a little bit about the SRC, if you are not familiar with the SRC. We are we're a nonprofit association of government and nonprofit organizations that serve seniors and persons living with disabilities. We provide our member organization with various types of networking and training opportunities and funding opportunities. We help them network among themselves and to build partnerships and improve the quality of life for older adults and people with disabilities in and throughout Southeast Michigan. So we kind of think of ourselves as a think tank of organizations that collectively come together to serve older adults and persons with disabilities. We stay committed and connected to being inclusive in all the things that we do and making sure that we're offering inclusive opportunities as well. We value the diversity of every staffer, volunteer, member agency, and partner, and our representatives of the community. We are inclusive of the populations and the critical communities that we serve and engage in. And we know that we're going through a lot right now within our nation, and through the SRC, we stand against all instances of social and racial injustices and inequalities. It's important that we bring that into the room because it does impact all the work that we do as we all seek among our partner organizations to make sure that services that we provide are equal and equitable across all frameworks. So with that in mind, I want to welcome our presenters today for this Lunch and Learn to tell us a little bit about the National Kidney Foundation of Michigan. Like I said, it's a place and a topic that's definitely true to my heart. Almost 10 years I worked at the Kidney Foundation as well. So definitely know these folk that's going to present to you. They have good information. And so everyone sit back. Thank you for joining us. And Ann and Lanita, I will turn it over to you.
All right, let me just put it into slideshow view. All right, there you go. So good afternoon. I'm Ann Andrews with the National Kidney Foundation, as Christy said, and we want to thank the SRC for inviting us today to present to you a little bit about what we do. And then my colleague, Lanita Pickett, will present also. I'm going to start it off though. So just to share a little bit about the Kidney Foundation. The National Kidney Foundation is the largest kidney foundation in the country. We offer more programs and services than any other in the country, and we offer programs from birth all the way through aging and disease. So the mission of the National Kidney Foundation of Michigan is to improve the quality of life for patients with chronic kidney disease and to prevent kidney disease by helping people at risk to live healthier lifestyles and manage their conditions. We do serve the entire state. We have offices that are located in Detroit, Ann Arbor, and Grand Rapids. So first of all, to give a little bit of background about chronic kidney disease. So chronic kidney disease is kind of what many people call a silent disease. Often people don't know they have it until they reach the need where they have to be on dialysis. Currently, there are about 30 million Americans who have chronic kidney disease, and 26 million are undiagnosed. There is a large cost for Medicare for chronic kidney disease, and this doesn't only represent people who are on dialysis with end-stage renal disease, but there are significant costs associated with earlier stages as well. And only about 10% of people with chronic kidney disease know that they have it. So the risk factors for chronic kidney disease can kind of be put into two buckets. There are the modifiable risk factors and the non-modifiable risk factors. So the modifiable risk factors are diabetes, hypertension, frequent use of nonsteroidal anti-inflammatories, and history of acute kidney injury. Non-modifiable risk factors are family history of kidney disease, age of 60 years or older, and ethnicity, so African Americans, Hispanic, Asian Pacific Islanders, and American Indian. People of those ethnicities are at greater risk for chronic kidney disease. So one thing that people often aren't aware of is that chronic kidney disease is a strong predictor of cardiovascular mortality. And it's important to make note of this because on most cardiovascular risk factor calculations, chronic kidney disease is not included. So we're just trying to increase awareness of that. This study here shows that the two tests for chronic kidney disease, the combination of those two was a stronger predictor of cardiovascular mortality than many of the commonly thought of risk factors for cardiovascular disease. So the National Kidney Foundation views, I'm going to just go through all the slides so then we can talk through them. Our work in kind of three buckets, so primary prevention, secondary prevention, and tertiary prevention. We'll talk in more detail about some of these programs, but from the primary prevention standpoint, we have school education programs that we offer in Head Start to encourage kids from preschool and school age children to engage in healthy activities and eat nutritious foods and engage in physical activity. We also have the chronic disease self-management program that we've offered for over 14 years. This is a program that was developed by Stanford University, and we will talk about that. We have the diabetes prevention program as well, and we are a recognized provider of that by the Centers for Disease Control. In terms of secondary prevention, we do screenings for kidney disease. When we are able to meet in person, we do several of these a year focusing on at-risk populations. We have the Diabetes PATH program and the Chronic Pain PATH program. And then we also have programs to help prevent or reduce the risk of falling. So that's the Matter of Balance program. And then the Enhanced Fitness program is something that can help with preventing falls as well. And then from a tertiary prevention standpoint, we have a peer mentor program where we train people who are living with kidney disease to talk with other patients. We have the Kidney PATH program. We have patient support that we can offer through phone calls. And then we also have several programs to educate about transplant and how to find a living donor. So in terms of the direct patient services that we provide to people who have kidney disease, we have an emergency fund. So a person who's living with kidney disease can receive $100 of assistance. It's often in the form of a gift card, but it can be in the form of a check. And this is to really address basic needs that the patient may have. I mentioned the peer mentor program. We also have low-cost medical IDs. So these are only $6, and we have them that can be purchased as a bracelet or as a necklace. We have the ability to provide information and support over the phone. We have someone who is living with kidney disease and has received multiple transplants who can talk with family members and patients. We have internships, short-term internships for people who are living with kidney disease. We have a scholarship program too, so for people who are looking to go back to school or recent high school graduates and living with kidney disease. We can help them support their education. And then we have a kids camp as well. We are not offering the kids camp this year, unfortunately, and we didn't last year, but we still are doing some things to try and reach out to these kids who are living with kidney disease. So first I'll mention the Big Ask, Big Give. These are workshops that we offer to provide information on kidney disease, transplant and dialysis, and the transplant evaluation process. This is a free workshop. We have one coming up on May 26th, and I have a link within the slides, but we could also circulate a flyer through the SRC. We'll have some representatives from different transplant centers who will be helping us to present the content. And it's really designed for people who are trying to find out more about the transplant process, or if they're considering looking for a living donor or being a living donor. We also offer the PASS programs. So the PASS programs are also known as the Chronic Disease Self-Management Program, which was developed by Stanford University. These are 6-week workshops that are held for consecutive weeks, and it is about 2.5 hours per week. It's led by 2 certified leaders, and it helps people to become an active self-manager of their disease. The National Kidney Foundation has designed a kidney version of this, where the original 6-week program, PASS program, is offered, and then we have 2 extra sessions that talk about kidney-specific content and living with kidney disease. So the PASS program really is built on the premise of teaching people tools to manage their chronic disease. So we talk about it in terms of a toolbox of strategies that you can use to manage your illness or chronic disease. And these strategies are physical activity, taking medications as prescribed, decision-making, action planning is a key component that is taken up every week, how to use breathing techniques and understanding and managing your emotions, problem solving, sleep, communication with your family, friends, and healthcare team is also covered, as well as the importance of healthy eating and working with your healthcare team. We offer the PASS program in 3 different versions right now. Given that we are still within the COVID-19 pandemic, we are offering these via Zoom. So we have distance learning via video conference. These are held in a small group of about 10 to 15 people, and it does require you to have a reliable internet connection and camera, but it still allows for that interaction between people. The National Kidney Foundation is also able to offer the Better Choices, Better Health program, which is the online version of PASS, because we have a federal grant that's supporting that. So this is different in that it is asynchronous learning, and so people can log on at their own time and review the workshop content and communicate with other participants and also other leaders. And then we also, for people who are not who don't have access to the technology, we can also do it where they receive a toolkit in the mail with some phone support. And now I'll show a little bit more detail about the Better Choices, Better Health program with some examples of what a participant would see. So this is showing the email that a person would get after they have completed a session. There is support provided by the coach and kind of steps to tell you what you should be doing. So make sure to complete your action plan, go to the discussion center to see what other participants are talking about or how they're doing on their action plan. There's a learning library, so people can access content about topics that might be interesting to them. And there is a celebration board where you can post potential or post things that you've accomplished, and other participants can congratulate you and comment on that. The action planning process is something that is part of all PATH workshops, and people make a plan to accomplish a certain action within the next week. What they do is they determine what that activity is going to be, how much. So for example, I want to walk, but you don't just say I want to walk, it's I want to walk 3 days a week, it's going to be Monday, Wednesday, Friday, and then give your confidence level in how confident that you are that you'll be able to achieve this action. This just shows you what a celebration board looks like. So participants were talking about disinfecting surfaces because we're in the time of COVID-19. There's walking, comments about weight, or somebody having to make an important decision, and they can get support from other participants and coaches. And now I will turn it over to Lanita, who will talk about some of our other programs.
Thank you. My internet act right. It's been acting ugly. So one of the other programs that we have is called our Diabetes Prevention Program. This program is for 16 weeks. It's weekly. But first we start off by monthly. And first let me back up. So the Diabetes Prevention Program is, it focuses on individuals who have type 2 diabetes. So NKFM have worked with CDC to create a curriculum to make it more relevant and important to individuals with the type 2 diabetes. So the diabetes program is an evidence curriculum. It is focused on providing accurate information on nutrition and physical activity for those who have type 2 diabetes. The need for this program had became available for us to do the program in 2017. So with that, the participants have made great success and was very successful with making healthy life changes. So the program is a 6-week core curriculum section. It meets bi-monthly, then monthly, and then we also do follow-up reminders of the program. So it also will help them reduce their weight by 7%. And as always, we always focus on the fat grams and the total calories during the program. Go to the next slide, Ann, please. So in the evidence program, as I just spoke about, we focus on what they're eating. So their low-fat diet, moderate physical activity, and then also our focus on to make sure within those 16 weeks that they lose 7% of their weight loss during the time. That's their goal, is to lose 7% during those 16 weeks. So basically how they do that is basically do a lifestyle intervention reduction, evidence of the diabetes to 58% and metformin 31%. Go to the next one, Ann. So one of the other programs we offer through the National Kidney Foundation is called Senior SNAP. With this program, we serve the seniors that's 60 plus, and with the program, we help the seniors apply for their SNAP benefits, which is called Supplement Nutrition Assistance Program benefits. So with this, normally the senior will call in to National Kidney Foundation, and they will be assigned to a case manager, and that case manager will walk with them through the process. So through this process, as we all know, with the SNAP benefits, you can apply for the full rental assistance, utility assistance, healthcare, and then they have some other benefits there that you can get assistance with. So we did list down the information of who they can call and contact through an email or a telephone call, and we can as well send it out in a flyer as well. You go to the next slide, Ann, please. So the other grant that we normally have that funds some of our program is called a fall prevention. So as we know, a lot of seniors, they take and have a lot of trouble with their balance. So with that, the falls are experienced by many older adults. A common experience managing fall risk is a normal and part of, however, falls themselves are not a normal part of age. There are three main types of risk factors we talk about with the individual. Most falls experienced by older adults results from interaction of number of risk factors. We don't all have risk factors. We each have our own set of risk factors. So with that, we have where some adults have the problem, physical risk factors are changes in your body and that increase your risk or a fall. For instance, if you active and you sit, legs become weak. Behavior risk factors are things we don't do that increase our fall risk. And these could be taking a greater risk like climbing a ladder to remove leaves from the roof, gutters, and even though at 82 you think it might not be a good idea for a to do it. But then the other risk factor that we look at is environmental, our hazard in our home or community, porch steps without a rail, a toilet that is too low, or a tub without the grip bars. You know, a lot of times you see the seniors that had a grip bars to help them get out of tub. So a lot of them don't have that. So this right here is where they end up having a problem with falling. That's why they have the risk. So we will bring together various stakeholders to develop a regional plan to reduce falls risk. We are working with program developers as they pilot test remote delivery options for the NKFM and Matter of Balance. So as of right now, I want to say within the last month, we were able to offer the MOB, which I'm going to talk about. Can you go to the next slide for me, Ann? For the Matter of Balance, we was able to offer that virtually now. Before, during COVID time, we had to cancel it because it was more in person, but as we worked with the developers and then did a pilot, they seen that it was to still do it virtually. So Matter of Balance, it's a 2-hour section. It's a peer group discussion, exercise, education, and some behavior modifications. It is an 8-week long program led by 2 certified lifestyle coaches that will lead that program. So in a community-based class, it's particularly who have significant fear of falling. All these exercises in a sitting or support standing, they do not recommend the same level of mobility as some of the other programs. It is a great start for later or stepping on programs. So some of our, we do offer like our enhanced fitness class when we talk about the Matter of Balance. So enhanced fitness go hand in hand with our Matter of Balance class. So our enhanced fitness is an evidence-based class. Right now we offer it virtually because we are not meeting in person right now. So we still have 1 hour long. We still have our certified instructors, the enhanced fitness, as well as we still have we had a participants log on maybe 15 minutes before class for the technical difficulty, make sure they're okay, make sure they can get on. Okay, we use the weights in the class as well. So we still do everything as if we were in person. We still do the same thing as we do in class. You go to the next one. And they do meet like 3 times a week as well for an hour. So the next thing that Kidney Foundation National Kidney Foundation is part of is we are a recipient of a multi-year grant from the Center of Disease and Prevention called from CDC. So in this program, it is called Racial and Ethnic Approach to Community Health, which a lot of times you might hear what we'll call, if I ever talk about it when we had our SRC meeting, REACH, that is like the short acronym for it. So just imagine it saying all of that over and over again. So with this grant, project focused on reducing health disparity experienced by African Americans and Hispanics living in Western Wayne County by helping to create healthier communities where people live, play, work, and pray. Our REACH program focuses on the organizational, community, and social interventions to make policies, systems, and environmental changes. To this, we work with the community partners to help people access healthy food and be physically active. So in this program, we are working at the cities that we're working on is Wayne, Westland, and Inkster. So these 3 cities we have been working on. We're going into our 4th year working in these communities. And like I said, we're targeting the African Americans and Hispanics in the community. You can go on and to the next slide. So in this program, we were able to develop or help get Inkster Task Force Farmers Market. And then we was able to improve policy and environmental changes at the pantries in Inkster and Wayne. And as well as we created a Western Wayne Food Policy Council. And then Espresso Milk Collective with Good Village Collective. And we're working with the Friends of the Ruwais to help create the Greenway and Water Trail in those 3 cities. The next one, Ann. So also with the REACH, we were able to, we also have a clinical linkage. So we work with an FQAC that's out in Inkster, and that is Western Wayne Family Health Center, Hope Clinic. So with these 2 clinics, we able to create a referral process. So with this referral process, we able to help get referrals where the patients are getting their flu vaccine as well as the COVID vaccine now too. So with this, we help both Western Wayne Family Health Center have a mobile clinic. So now they're working in the communities to help deliver these vaccines. As we know, sometimes transportation, Western Wayne County is limited, where they only have 1 bus line that actually go up and down Michigan Avenue. So the transportation have always been a problem out there. So now the clinic is going into the communities to make sure that the residents of those communities are vaccinated. And then also we use as our trusted messengers to help get this message out to the community, the importance of getting the flu and the COVID vaccine. Next slide, Ann. So I know it was a quick little snapshot of what we do here at Kidney and what I just explained about REACH. But if you're interested in learning more about the work that we're doing up under the REACH program, this is the link that you will go to. And also I can have the SRC circulated around so everyone will be able to look at it at your time.
Thank you, Ann and Lanita, for all this wonderful information. We wanted to open it up for any questions. You can put them in the chat, or you can just come off of mute and ask any questions you have about any of the information. I know for myself, I would like for us to promote your workshop you have coming up on May 26th. I think that was the date. So if I could get those flyers, we will definitely post that and boost it throughout our social media platforms, as well as all of our collaborative members. So I know there was something May 26th. And also if there's any workshops, especially around the vaccine, we can help promote those as well, because we want to get that education and those words out. So just let us know, we can help move that information as well. So definitely want to promote this Big Ask, Big Give workshop on May 26th from 6 to 8 p.m. Are there any questions from anyone, any comments? This was great information, lots and lots of resources. And I also noticed that you guys have a resource guide. I'm not sure if you guys can talk a little bit about that resource guide and how that was put together and what it actually, the communities that it actually covers.
You want to do that, Lanita, or you want me to?
You can go ahead.
Okay, I can get to that. Let's see, that one, there was a picture at the end. There we go.
Yeah.
So this is something neither Lanita or I was involved in putting it together, but we can share a little bit. So this was something that was just released probably about within the last month. and it is a guide for how to find resources. So it's not necessarily what all the resources are, because we know that those things change frequently. So there was a lot of work put into this, and it was really compiled by our childhood staff, but also some social workers who have a lot of experience with different social service agencies and how to find and help people find resources. So this is focused on Wayne County. It is available electronically, and so we could send you that link as well.
Yes, we have added it. I did get it earlier in the
great.
month.
Okay.
And so it is, if you
Good.
go to the SRC's website, SEMI-SRC, we do have it there. We will also be including it in our newsletter, as well as posting it to our social media platforms. And I think, thank you for that, the difference that this is really a roadmap, a guide to how to find and access services versus a guide of resources, because you're absolutely right, and they change so frequently. Any other comments or questions, thoughts? Okay, with all that in mind, I am going to thank everyone for their time this afternoon. And if there's any questions or comments, please feel free to contact myself at semisrc.org, or you can contact the National Kidney Foundation regarding any of their programs or services that they actually offer. If that is all for us today, I will say goodbye and thank you for joining us for this Lunch and Learn.